Good morning, Twin City. This is your host, Clarence Jones of Community Health Dialogues. Thank you again for tuning in to our program tonight, and we appreciate the opportunity to share information with you. Tonight on our program, we have Julie Kimmick and we have Lindsay Williams, and they are from LifeSource, and you probably know in the past that we have had LifeSource as one of our community partners. In fact, LifeSource recently, maybe about 2 years ago, they actually moved into North Minneapolis, and they are an organ and tissue procurement organization, and they have really been a good community partner with us in terms of the many events that we have held within our community. But tonight we're going to talk about a topic that we've been talking about for a long time. It's about COVID-19. But it's even more than that. It's about what are the other factors that are being impacted by this issue, and how does it continuously impact the health of our community. One of the things about this particular topic, COVID-19, is that it's inescapable, no matter where we go. And it's like it's the overarching conversation that people are having. But it's not the only issue that we have in our community. And one of the things that I am very concerned about is the fact that we are sometimes overwhelmed by this conversation, and we forget that there are other things that are happening. And so we're going to talk tonight with Julie and Lindsay about organ donation and COVID-19, and we're going to talk about how this issue is impacting our community and why it's still important for us to have this conversation also among the topics that we're talking about. So welcome, ladies, to Community Health Dialogues.
Thanks, Clarence.
Okay.
Glad to be here.
Yeah. So I think that because we've talked about organ donation in the past, we may have some listeners that may not understand this. Can you talk about the typical organ donation process?
Sure, I'd be happy to. Thanks again for having us. So organ donation happens in a hospital. So let me start with that. The person is in a hospital, and when someone suffered an injury that is not life-sustaining, we will get a notification from a hospital to let us know about this individual. We will do some quick assessments at that time to make a determination if there's an opportunity for donation. And if we think there is, then that's a time for us to have a conversation with the family, and we will share with them if their loved one was a designated donor and what the process will look like. And if they're not, we will give them the opportunity to make a decision on behalf of their loved one about donation. And so once the family says yes and we get moving along, then we'll do a deeper dive into looking at all of the organ systems and are they functioning, looking at every single one, making sure that it's safe to proceed, that any recipient who might get an organ, that it's going to be safe for them. After that is complete, there is a national database that is anonymous where we enter all of this information in, that then creates a match for those who are waiting for an organ. From that match, we then contact those transplant centers and line up the recipients that are going to receive these precious gifts. Once that is complete, the transplant centers come to the donor's hospital and the surgery takes place, and the gifts are then sent back to each of the transplant centers. So that's a pretty high level. Does that make sense? Any questions you want to ask?
Well, it makes a lot of sense. And I think that what I want to ask now for Lindsay to do is to talk about why will we talk about organ donation? Because one of the things is that people have this, they hear the term organ donation, but why is it important for us to even talk about this, and especially among our listeners? Lindsay?
Yeah, so one thing, especially now, is that organ donation is no different than anything else, in that it is still impacted by COVID. And we're lucky to have Julie here today. She can kind of talk us through what those changes look like, how we're being safe in organ donation. But the need is still there. The people who needed organs before COVID continue to need organs. We continue to do this work to save lives, and we continue to ask people to have this conversation about organ donation. And especially in communities of color, we see that there's, in minority communities, we account for about 60% of people waiting on the national transplant list. So this really is something that affects communities of color, not only African Americans, but the Latino community, the American Indian community, and it just continues to happen regardless of whether or not COVID is happening. And I think that's why it's important for us to talk about this.
Well, let me ask you one question, because that really struck me. You said 60% of the people that are waiting?
Yep. That's as of
Okay.
about the middle of last month.
Okay.
And that percentage might fluctuate, it might
Sure.
decrease, but just to give you an idea of like the snapshot. And I can tell you too that, African Americans make up about 14% of all organ donors,
Sure.
but we make up about 29% of the waiting list.
Wow. Wow.
Yeah. So, and that's, I think we just need to have more conversations about organ donation. And that's a big part of why we're here today too, just to encourage people to have that conversation. A lot of times we find that it's not that organ donation isn't something that people don't believe in. It's just that when someone passes away, it's like, we haven't had this conversation. I honestly
Right.
don't know what they want. And so we want to encourage people to just be having that conversation so that we can all be part of saving lives.
Well, it's interesting because I know that for many of us, we have on our driver's license the fact that we want to be organ donors. And I think that in a time like this that we don't necessarily think about it, but we need to be thinking about it because the need, as you said, is still great. But
Mm-hmm.
I just believe that because of this overwhelming amount of information that's going out here around COVID-19, people are not sure about what they could do. The passion is still there, the interest is still there.
Mm-hmm.
But can you talk about the impact that COVID-19 is having on organ donation and whether people can still be a donor if they even have COVID?
Yes, I'd be happy to. So if someone currently has COVID, right now, no, donation cannot occur. So we do know that this disease is highly infectious and we don't know all of the ways it can be transmitted. And so not just because of could it be transmitted to the recipient, but could it be transmitted to the healthcare providers who are taking care of the recipients and the donor itself? So right now, if someone currently has COVID, they are not eligible to be a donor. But that doesn't mean once they recover from it and years from now or something might happen, then they can be a donor. So people shouldn't think, oh, I've had COVID, I can't be a donor anymore. That's not true. Certainly true in the moment, but long term. And again, most people do survive COVID. So we do expect in the future, there will be many people who've had COVID in the past and then are able to be an organ donor.
Yeah. One interesting thing to me in terms of our preliminary thoughts was that hospitals right now for many people are danger zones. They feel like they're danger zones. And what's your thought about that? I mean,
That's a great question, Clarence. And I would encourage people to not be afraid of the hospitals, especially if they need medical care. Hospitals are probably the safest place you can be right now. They are fully prepared and equipped with all of the PPEs, the protective equipment that they need to keep you and each other safe. And that's what my team members say. Of all the places they have to go, the hospital is the safest because they know people know the protocols, they know what to do. So everyone's been prepared. The public has done a great job of giving hospitals time to prepare, and they're ready and they can take care of you if you need their help for any reason. So don't be afraid to go in for any reason you might need health care, and know that they're going to treat you very well and that you will be safe from COVID from them. It's probably it's going to be safer than going to a major department store or some other place for sure.
Yeah. I'm glad we're having this conversation because truly there has always been a concern about the hospitals and doctors and things like that in the community. And, this particular disease does not make it any easier for us to talk about this. And I'm glad that we have the opportunity to talk candidly, which is one of the things that I really believe in terms of this topic. And we still have to make people aware that although we have this particular pandemic right now, the need hasn't changed.
It
The
has
need,
not.
yeah.
Yeah. There are
And
so many people waiting and counting on us to do our job every day to get them those precious gifts. And yeah, that need has not changed and the work has not stopped.
yeah. So what kind of conversation should should people be having with their families around organ donation during this period? I think that uh, I just believe that people are so focused on one thing, but we need to be talking about a lot of different things. So how would you enter into a conversation or with the community about what we should be talking about around COVID? Nobody likes talking about death.
Nobody does like to talk about death. And one of the ways I think we could enter into the conversation, I'd love to hear Lindsay's thoughts too, is that we can, right now, it's more important than ever that we care for each other, that we are taking care of each other in all the ways that we can, from wearing masks to washing our hands to signing up to being an organ donor. All of those things matter of how we can care for someone else, both now in the moment and in the future, and when something happens to us and the opportunity provides. Lindsay, what are your thoughts on that?
I know that people don't like to talk about death, but I am an avid planner. So what, I've had these conversations with the people that I love, because it's really important to me that they have instructions after I'm gone. And I can just share too, that conversation, about end of life, it doesn't always, I think that it's one of those things that there's more nervousness and, anticipation beforehand. Because of the work that we do, I had made it very clear to my husband, what my wishes were. After I passed away, I wanted to make sure that he had no questions, that he had, he understood exactly what I wanted. But one day I realized I hadn't asked him what he wanted. He's from Chicago. Do you want to be buried in Chicago? Do you want, and it took him maybe 2.5 seconds. And he said, the best way to honor me is to do whatever's cheapest.
I get that.
That's right. And it was a really funny conversation. But he meant that, he was like, for a lot of people, they have very specific instructions, but for him, it's like, save your money,
Yeah.
And so I just share that because it's not always, a lot of times it's going into that conversation about what people want is scarier than actually having the conversation. And what a relief for me to know that the only question I need to ask is, what is your cheapest option? And that is how I will honor my husband, because that is what he's requested from me.
Yeah.
So that's what I would say. I know it's tricky, but I promise that it's so much better to have that information, to have had that conversation, so that if something happens, you know what your loved ones want.
Yeah, it's really interesting that you said that, Lindsay, because I had this conversation with my family as well.
Okay.
I told them that when I die, make me a tree.
Yeah.
I don't care if it's a pecan or oak tree. And they look at me like I'm crazy, but I'm like, whatever I've done, I've done. You know what I mean? So I think that part of what I'm hoping that will happen during this period of time as we're talking to our listeners, is that we don't lose sight of the fact that life still goes on.
Mm-hmm.
I remember the first couple of months that we were in the midst of this pandemic, how people were just, somewhat frozen. I mean, information kept coming out, what about this? What about that?
Right.
Whether you should use a mask, whether you shouldn't use a mask. People were really frightened by the thought of this this disease, but many times they forgot that their life still went on. I mean, they still needed to go to the doctor. They still had high blood pressure.
Mm-hmm.
There were still issues around organ donation, transplants. Still people
Yeah.
need blood transfusion. I mean, all these kinds of things. And I think that at some point we have to get back to this place where even though the conversation is uncomfortable, you know, it's not something
Yeah.
that we would love to that we just want to sit around and eat tea and crumpets by and talk about. But
Right.
it is something that is true, and it's important. When you talk about this issue to the community right about now, what are the real points that you want them to understand? I mean, we know that organ donation is important. We also know that, and I want to say this to the community as I'm sitting here. Life Source, while we might be talking about organ and tissue donation, Life Source has been on the front line of prevention as well. I mean, they have been in the community doing many things around preventative things, and I want to let you know that it's not just one way. They have been bi-directional in terms of their support, not only to me, but also to the community around health. But what are the things that you really want the community to know during this time?
Yeah, so what I would point out as far as organ donation, of course, we want people to have that conversation, check the box if that's part of your values and your beliefs for sure. But I think right now regarding COVID and donation, one thing that I would point out is that you know, when you walk into Target, you don't know who has had a transplant. And if someone has had an organ transplant, they are on suppressive medications so that they can continue to have that gift of life. And when we all wear masks, those people, not only those recipients, but those donors who gave those gifts, we're honoring them as well. We're keeping them, we're making a safer space for them to do things that they need to do as well. And you can't tell just by looking at people, you know, at the store who's had a transplant.
Mm-hmm.
So I would just really encourage everyone to, you know, follow. It's just the rules you've heard. There's, you know, no other magic thing. Please wear a mask, wash your hands, be using hand sanitizer, you know, physically distance, because, you know, there are people out there who are walking around with these amazing life-saving gifts
Mm-hmm.
inside of them. And it's just another way for us to honor those donors, those people who said yes to donation to save lives.
Yeah.
Yeah.
Julie, I want to ask you a question. How did you come to this work? I mean, one of the things that we always try to do in our work is that since you are involved in engaging with the community, we want people to know you, and we want people to feel comfortable in terms of if there is a need or a request that they have the freedom to be able to speak. And that's what we found with Life Source. Life Source, but I listeners don't know you. Tell us a little bit about you.
Yeah, sure. So I started working in the operating room right out of school. And that's where my first exposure was to transplant. And I was able to help with cornea transplants and kidney transplants were the first transplants that I was able to help with in the operating room. And I will never forget putting in the kidney for the first time, and it started to produce urine before we even closed the patient, before the surgery was done. This person who hasn't peed for years was right there in front of my eyes making urine. And it was just awe-inspiring. And I wanted to know, who was this special person that gave this gift? Who were they? And as I did more of these procedures and again, helped with the cornea transplants and saw people seeing right there in the operating room saying, hey, I can see you, doctor, now, was amazing. And so that inspired me to learn more about the donation side. And not too many years later, I started working in donation and have been in this field for over 35 years. It's been a long journey, and I've had a chance to see and meet amazing people that in their time of grief and loss see hope and healing in donation and transplant. People inspire me every single day of how they can get through tragedies.
You know, that you know, when you were talking about that, I mean, the whole idea about, you know, seeing urine being produced, you know, before it's completed. I mean, to me, that is so life affirming. And I think those kinds of experiences really help people to understand why this work is so important, especially if you have a loved one that cannot do those things and they need an organ. And it's just important for people to understand that there are things that are so important for them to consider as we start talking about this particular piece. Where do we go from here? I mean, this whole idea about COVID-19, what is it that you want to see from the community? What kind of ask do you have for the community?
I think some of the things we've already said, that in the midst of COVID, the number of people who still need an organ transplant continues. That has not changed. As much as many things have changed, that has stayed constant. And donation took a large dip for a while. And so while there was fewer donors, those waiting were still waiting. And so we've been working very hard to make sure that we can get as many gifts to those as possible. And so for families to have the conversation, to check the box if it's aligning with what they believe in, and to have trust and faith that those who are waiting, we're going to do everything we can to make sure they get safe gifts. We are working tirelessly to make sure everything can be done to make sure those gifts are safe, that those recipients receive.
Lindsay, what do you think? What's your message to the community right about now?
You know, our message about donation hasn't changed. I think right now, I just want everybody to be safe, you know, as safe as we can make one another, creating those safe spaces. I know it's hard, you know, we've been physically distancing, you can't hug loved ones. It's hard. But you know, just for people to continue to be vigilant, to do those things that we know that will keep us and others safe. That'd be my request. And I think most people are doing it and doing a good job, you know, but I know it gets hard. I'll share, I'm 8 months pregnant right now. I can't hug my mom and dad. That's really hard.
Yeah.
You know, like it's hard for me, it's hard for them, but you know, if keeping my distance keeps them safe, then that's what we're going to do. I know it's been a long time, but you know, let's keep each other safe.
Yeah, keeps them safe, keep you safe. Yep.
Keep me safe.
Yeah. And I like that idea, because I think that what we have here today is we have the clinician, we have the community person. And so, Julia, I just want to ask you, what should the community be doing to keep itself safe from a clinician standpoint of view?
I think all the things that you've heard and what Lindsay's been saying is really keep that distance. The distance is so important. The spread of the virus is tricky, and that distance is going to be a huge thing. Wearing your masks, washing your hands, limiting when you go out. You know, this is not the time to be going out hanging in a bar. Now's not that time. That time will come again when it's time to go out and hang out with a group of people and have fun. But right now, hopefully people have selected a few people that they can be with and stay together with and be safe while they're doing that. If you do need to meet someone, doing it outside, keeping again the space, all of those things that you've been hearing about is so, so important.
Yeah, thank you for that. I know that, and you both have said the same thing. It's like, it seemed like we just being repetitive. We're saying the same thing over and over again. But when we started going through this whole issue, I remember people talk about washing your hands. Well, we were always told to wash our hands, you know, but I think we didn't realize how important it was to stop diseases, and you know what I mean? And so this whole idea about, we're doing this thing over, we're saying it over and over and over again, but it's the most basic way that we can protect ourselves, you know, keeping a mask on. People are fighting about masks, but yet and still we know that, you know, wearing a mask is something that's going to not only protect others, but it's going to protect yourself, you know what I mean? And so I know listeners that this seems like we're doing the same thing over and over again, but you know what? We have to, because the epidemic is spreading. It's not stopping. You know what I mean? I'm not proud of that. I'm not happy about the fact that it is now in more places now than ever before, and that we've had over 150,000 people die. I'm not proud of that. And I think that it's important for us as members of the community to understand what our real role is in terms of keeping each other healthy. And so I'm not fussing. I'm not gonna cuss. So what I am going to say is, let's take care of each other. Let's watch ourselves. And so I do want to thank both you, Julie and Lindsay, for being a part of our show tonight. And I thank you for the work that you're doing. I know that it's important. I know that there are people that are listening to us right now that are on the waiting list. There are people that who are potential donors. I just want to keep this issue in front of people. It's not going to go away. And so I thank you for the work that you're doing. Any last comments or thoughts that you might have?
Well, thank you, Clarence, for continuing to make this an important conversation to have. It remains a conversation, and it will for years to come that we have these conversations. I ask everybody out there, yes, please be safe. Please take care of each other. We'll hug soon. There'll be hugs soon. I'm looking forward to that myself. And thanks to everyone for their being so diligent and taking care of each other.
Okay. And Lizzie, give us a contact number in case somebody needs to contact LifeSource.
Yeah, you know what? If you've heard this and you have some questions, why don't you go ahead and call me directly? You can reach me at 651-329-4211, and I would be happy to answer any questions you have about organ donation.
And you got 8 months though, and so you'll make sure that the call is transferred, right? So somebody can call back, right?
Yeah. For the next, if you think of it in the next 4 weeks, I think I'll be around. So give me a call.
All right. Well, I want to thank both of you, and listeners. I want to thank you for listening to Community Health Dialogue. We will talk with you again next week. Have a great evening.